speech, and this is my career speech. When I'm older, I want to be a nurse practitioner. I'm interested in this job because my mom is a nurse. Also, at home we see a nurse practitioner rather than a doctor. I am also CNA, so I already participate in the health field. The college degree is required for the job. First, you need to get your BSN, which is your Bachelor's of Science in Nursing. Then you need to go on to grad school to get either a master's or doctorate. Total, you have completed 6 to 8 years after high school. You also need your nursing license by completing board certification and passing state exams. The average salary is about $90,000, but there is a wide range. The duties include providing primary care, taking health histories, performing physical examinations, diagnosing and treating illnesses, providing immunizations, manage chronic health problems, order and interpret diagnostic tests, prescribe medicines and therapies, perform procedures, educate and counsel patients and their families, and refer patients to other health professionals if needed. In an interview with a nurse practitioner, she said the best part of the job is building a relationship with parents and families and seeing all ranges of people from young to old and teaching people about health. She says the worst part of the job is only being allotted 15 minutes per patient and that nurses are trained to prevent rather than fix. Future education, for being a nurse practitioner, there is a lot of continuing education required. You have to continue to get your first aid certification. You need supervised clinical experience. Every 2 years, you need to renew your CPR. Every 2 years, you need to renew your ACLS, which is code situation. You also need to renew your NALs and PALs, which is codes for newborn and infants. You need to renew your nursing license every 3 to 5 years through many courses or seminars. You need to keep up with the new treatments and medications. In the same interview with the nurse practitioner, she said what her typical day is like. She usually gets to the office around 7:30 to 8 a.m. She checks her emails from administration, office, nurses, and patients. She checks her mail for correspondence for medical news. She might meet with a drug rep to look at new medications. Then she looks at the charts from the nurses with questions from patients. She gets her patient list for the day and makes a schedule and decides on possible treatments for those patients. She sees about 4 to 5 patients in an hour. Then she goes to her half-hour to hour lunch. After lunch, she sees more patients. She will consult with physicians, see admitted patients for checkups, take phone calls, and a couple of times a year do her continuing education. Good personalities for this job include creative thinker, critical thinker, cope with stress, fast thinkers, compassionate, empathetic, patient, non-judgmental, interpersonal skills to communicate effectively, and analytical and observational, and attentive to detail. The attire is nice dress. It's business casual and typically with a lab coat. Some more facts are that nurse practitioners can prescribe meds in all 50 states. However, they can only practice independently in 26. Approximately 15% of nurse practitioners have a private practice. You can choose to specialize and subspecialize. There is an excellent job outlook. The nurse practitioner origin in mid-1960s due to lack of physicians. Becoming a nurse practitioner is something I have recently been considering, and this speech has helped me be able to find out more about the career. Healthcare is an important field, and the demand for healthcare professionals will always be present. Thank you.